are both covered by our health insurance, by my work, but I do not know what's going to happen next month. The problem is, state buildings and institutions are no longer paying cleaning company that I work for enough to cover our health premium. If this continues, my wife is going to lose her health care coverage, and we don't want that. This will have a heavy impact on my family. My wife and I both, we depend on medicine to control our blood pressure. My wife is also on medication for an ongoing health care, and I have prescription for arthritis. The truth is, we can't afford to cover the coverage of this health cost on our own. When I moved to Connecticut 3 years ago, my wife and I were without health care for 3 months. It costs us about $250 to $300 a month for our regular medication. And that was without additional sickness or emergencies. We are going to have to choose between keeping our house, keeping my house, or health care. Members, what we need members of the General Assembly to understand the health care struggles we are all facing now. With a bipartisan support, the House and Senate passed the bill to fix the standard wage law, which would have protected our health care for my family and the families of the state buildings across Connecticut. But the governor vetoed the bill on Thursday. Now the governor has 2 more bills in front of her that will ensure people living in Connecticut to go to the doctor without worrying about how or if they can pay the bill.
Sign the bill! Sign the bill! Sign the bill!
Sign your bill! Sign your bill!
Sign the bill! Sign the bill! Now!
2 things I am asking today. One is for our legislatures and one for the governor. Members of the legislature, assembly, I know this is your summer vacation time. But if you do not return to the capital to override the governor's veto bill to fix our standard wage law, hundreds of children of cleaners of the state building will be kicked off the healthcare insurance before the summer ends. And we do not want that. Keeping the state buildings and institutions clean, we take it very seriously. We hope the state legislatures are just as serious about their responsibilities. To ensure the state operation and maintained by a workforce that can depend on health care for their families. And to the Governor Rell, please, I and all those thousands of people out there are begging you, sign the healthcare bill today so we no longer have to face the dilemma going to the doctor or paying our bills. I thank you very much for your time.